Good morning, everybody, and welcome to our chapter chatter for March. It is springtime finally here in San Jose, and we're coming to you live from our San Jose office. My name is Claire Day. I'm the Chief Program Officer, and I'm here to bring you all the latest updates from our news for the Alzheimer's Association. So we're going to start right away and get right into some breaking news on research. I think some of you may have heard and been following along the way about recent reports from Biogen and Eisai, who announced that they're actually going to be discontinuing their phase 3 clinical trial on an beta amyloid drug that has shown that it most likely will not meet its statistical endpoints at the end of the trial. Let's start a little bit with talking about what that means to be a beta amyloid trial. So beta amyloid, we know, is that sticky protein that builds up in the brain and causes one of the hallmarks of Alzheimer's disease, that amyloid plaque. And so this is one of almost, I think 16 or 17 trials that are going on, 30 trials that are going on around 16 drugs that are targeting beta amyloid. And so what they do with these trials now is they're able to sort of evaluate mid-trial to really see whether or not it's going to come to fruition and have the ability to make some moves. This was a drug that in its early phases, phase 1B, did show that it had some strong evidence that it was clearing beta amyloid from the brain. So it shows a lot of promise early on, and we always find those to be sometimes disappointing. But the reality is those phase 1B studies are very small, and so the point of moving those drug trials on to a phase 3 trial is to really see whether or not it's going to have impact on a larger scale. And this mid-study trial really did show us that it wasn't going to be statistically significant, and so the drug company decided that they were going to end that. And we always see some disappointment and frustration, I think, when those things get announced. We know people that were participating in those clinical trials who really put a lot of hope and commitment into ensuring that these trials move forward. But here's the thing we need to know about research. So Alzheimer's disease is a complex disease. It's going to take a complex answer for us to find the cure, to find an effective treatment. And from every failure, we really do learn more and more every day that are helping scientists across the globe to end this disease. And so while we feel disappointed in its immediate announcement, and I know that I share that along with a lot of my colleagues, we also know that now is more important than ever for us to be moving this mission forward, and the Alzheimer's Association remains committed to fight till the end of this disease. So let's move on with a little bit more fun stuff and talk a little bit about some upcoming events, because I've said this before and I'll say it again, that even if we did find that effective treatment tomorrow, we know there's still 5.8 million Americans living with Alzheimer's disease today, and probably twice as many caregivers who are going to need support, and boy, do we have the answer for you here. So we've got lots of upcoming events educational events throughout our area, from Chico to San Jose and everywhere in between. I just want to highlight a few of them here. We've got our education conference in Chico, California, coming up on April 3rd, just next week. On April 6th, here in Santa Clara, we're going to see the Chinese Caregiver Forum. That's a great event held by our colleagues Pei Ning and Xiaorong here in our San Jose office. On April 13th, our African American Education Forum in Berkeley. And on April 27th, that'll get us caught up until our next chapter chatter, the Latino Forum in San Jose. And there's some other great professional and caregiver-based educational programs being held between now and then. I encourage you to go on to alz.org/NorCal and find the latest educational programs that will keep you up to date. So as we also think about April coming up, this will be the last time that we talk to you live before National Volunteer Week, which is the week of April 7th through 13th. And we here at the Alzheimer's Association really do believe that volunteers help our world go round. We cannot do what we do without the dedication of the hundreds of thousands of volunteers that we have across the nation, and especially here in the Northern California, Northern Nevada region. If you're watching live today and are one of our wonderful volunteers, I encourage you to post on our comment on our page here about the wonderful things that you're doing. But really just wanted to take this opportunity to thank all of you for all that you do. It's that work that helps us. We're a small team, we're small but mighty, but we need volunteers to help us get to areas we're not reaching, to help us make those connections through public policy, through Walk and the Longest Day, and especially with our program and our care and support group facilitators, community educators that are going out to help really make sure that people understand Alzheimer's disease and learn about caregiving tips, all of the wonderful things that you do. We celebrate you throughout the month of April. You're going to see some fun things coming out from our social media channels, but really a huge big thank you to all of our volunteers for all you do. And we'll start talking about some of those volunteer-driven activities that we do. First, coming up, of course, we're 85 days away from the Longest Day, and of course we know that the Longest Day is held on June 21st, the longest day, the summer solstice, and it's that day that we, with the most light, that we're going to fight to end Alzheimer's disease. I know many of you are doing some fun and unique things. We know that people have movie nights where they invite their friends over and watch a movie. We know there's a lot of fun activities done around biking and running and all kinds of fun activities that way. It's about doing what you love and raising money and awareness for the Alzheimer's Association and for Alzheimer's disease. I'm going to be hosting this year a wine and cheese pairing. I'm going to do a wine and cheese pairing at my home and invite people in to contribute a little bit of money and drink some really great wine that I have that's collecting dust that I think will be a great sort of way to do some good and have a good time at the same time. And you know, we can't talk about the Longest Day without thinking about how we can do some more to reach out. And so our pal Stephen Krasnowski is our Longest Day manager, does a lot of amazing things. He's got a little chapter event to help encourage people to start a team for the Longest Day. And so between now and April 15th, if you register for the Longest Day, not only will you receive the amazing Longest Day welcome kit with all the good information, but you'll also get one of these beautiful magnetic logo pins. Well, I thought I'd talk a little bit about our logo. You'll see here, what's great about this is it doesn't hurt your clothes, so you can see it just attaches to the back of clothing. But you know, our logo is about the work that we do. It's about people and it's about science. And people often ask us, you know, what's this little squiggly thing that makes up our logo for the association? And it's really about the people that we're serving, the care partners, people living with the disease. And so if you think of that as their head, and then the research, our vision of a world without Alzheimer's. So it represents the sort of research side of what's being done through the amazing work throughout the world that's really fighting hard to end this disease. So you will get one of these wonderful logo pins that you can wear proudly. And you know, it's oftentimes that those things that look different to people will make them ask you the question, well, what does that pin mean? Why are you wearing it? It'll give you an opportunity to explain what you do to volunteer or raise money or raise awareness for the Alzheimer's disease. So, you know, the Longest Day is our second signature event. We have our largest signature event for the Alzheimer's Association, of course, is the Walk to End Alzheimer's. And registration is open now. It's live. We've talked about in the past on our chapter chatters ways that you can get involved. Certainly start a team. We want to raise awareness in the community, but we also wanted you to get to know some of our team. So I'm going to invite up one of our newest Walk team members. This is Vivian Vo, and she has been here now for 4 days. Yes. This is day four of your work here at the Alzheimer's Association, and is working as our development specialist here in San Jose on a number of walks across the region. We're so delighted to have you on our team.
Thank you for having me.
I'd love for you to share a little bit about what brought you to the Alzheimer's Association.
So several years ago, actually, I was working in a nursing facility supporting families and residents who were definitely affected by Alzheimer's and dementia, and I got to see firsthand how it not only affected the residents but also the families. And when I saw the opportunity to join the Alzheimer's Association, I just hopped on it, applied, went through the hiring process, and I'm really happy to be here today. And everyone at the chapter or the office has been super welcoming and warm, and yeah, I'm excited to see how I can support the team and get us closer to a cure.
That's wonderful.
Yeah.
We are absolutely delighted to have you on board, and love the energy that you're bringing already to the office, and we're so glad to have you. You know, you've been here for 4 days. You've seen and met some of our office mates and some of our office four-legged office mates, right? We have a number of, we talked about Enzo this morning, whether or not Enzo could make a guest appearance, but he's a little too hyper, I think, for Facebook Live. Do you have any pets at home?
I do. I have a Sheltie. His name is Grayson.
Oh,
yeah,
great.
He's like a miniature Lassie. And he's actually, the funny story is he's named after 900 Grayson, which is a restaurant in Berkeley. On our way to pick him up, we thought, oh, this is a really cute name, let's add it to the list, and it just stuck.
And it made it to the top.
Yeah.
Oh, that's great. And you know, there are pets that are welcome at some of our walks across the region, so you can bring your four-legged friends with you and meet Vivian and some of our other team members. We have some new walk managers across the region that we're going to be introducing to you throughout the months coming up to Walk 2. But we're so delighted to have you. Thank you for joining me on the Chapter Chatter. Yes, great. So finally, you know, we started on a really low note. We talked about the Biogen trial being canceled, and we're going to end on a high note and just give you a little bit of information on our very, very soon to be upcoming Alzheimer's Impact Movement Advocacy Forum, which will be held in Washington, D.C. just next week. Our advocates, we have over 100 advocates, I think it was, that Ruth said, from California, and a number of advocates from Nevada who are going to be making the trip across country to Washington, D.C. starting on Saturday and Sunday. The forum actually starts on Sunday. This is our annual meeting of advocates across the nation, where we get together, we learn a little bit about Alzheimer's disease research, we learn a little bit about what's happening from a political and advocate standpoint, what bills are going to be are highlighted for the year, and then on Tuesday, those advocates will be turning the Capitol purple in Washington, D.C., and they'll be visiting their local legislators. And we've got a couple of new bills that are just sort of hot off the press here. I'm going to refer to my notes because they are literally hot off the press, and I want to make sure that I don't mess them up. The two bills that we're going to be talking about next week with Congress, one is called the iHope, or the Improving Hope for Alzheimer's Act. So if you remember, for years we've been talking about the HOPE Act. The HOPE Act would bring awareness and utilization of a caregiving code that could be used for physicians and healthcare professionals to bill Medicare to provide important caregiving information to patients upon diagnosis and their caregivers throughout the course of the disease. So the HOPE Act, while it never actually came to fruition, that happened because CMS took the initiative to say, we're not waiting for the HOPE Act to pass, and we're going to create that caregiving code, which is now an active Medicare code that physicians can use. And what we're finding is that not a lot of physicians either know about it, or maybe they're not using it as much as they could be. And so the Improving Hope for Alzheimer's Act is going to provide education and outreach to improve awareness and utilization of that care planning service that is covered by Medicare. So super important ask, a really easy ask, hopefully for our members of Congress next week. And then the second one is one that I'm really excited about, and this is called the Younger Onset Alzheimer's Disease Act of 2019. So younger onset is Alzheimer's disease that affects people who are younger than the sort of typical age that we think of for developing Alzheimer's, so under 60 or 65, people in their 30s, 40s, and 50s. And oftentimes we find that they bring unique challenges to their care and support, and often don't qualify for some of the programs that older adults get to benefit, and certainly those through the Older Americans Act. Some of those amazing programs like Meals on Wheels. Someone who's under 60 would not qualify for those programs because of nothing more than age. Well, the Younger Onset Alzheimer's Disease Act of 2019 would amend the Older Americans Act and allow individuals under 60 who are diagnosed with Alzheimer's disease or dementia to be able to access those amazing Older American Act support programs that are happening across the nation. So we're really excited about those two new pieces of legislation. Those advocates are going to be have a great opportunity to educate Congress about what they are. So we wish any advocate and staff who are going to Washington, D.C. a safe trip. If you are going, take a moment to comment and tell us what you hope to get out of the Advocacy Forum this year. We know it's going to be an amazing event. It always is inspiring, and it brings us sort of that great piece together of reminding us why care and support and research and using our voices is so important in helping to move this mission forward. We can't do it without all of you. We thank you for joining this month. It's great to be with you all, and have a wonderful Thursday.